Hello everyone, welcome back to my channel Dr. Ayurveda Medico. In this video, we will talk about rheumatoid arthritis. So basically what is rheumatoid? It is an inflammation of joints. It is more than that, but rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition can damage a wide variety of body systems, which includes the skin, eye, lungs, heart, and blood vessels. An autoimmune disorder. RA is an autoimmune disorder which occurs when your immune system mistakenly attacks your own body tissues. The inflammation associated with RA is what can damage other parts of the body as well. It causes the physical disabilities of the individual. Now, understanding the sign and symptoms of RA. So with RA, there are times when symptoms get worse, which is known as flares, and sometimes they get better, which is known as remission. So flares and remissions, if this are present with the pain, stiffness and tenderness of the joint, is then we will clearly understand that it is the symptom of RA. Pain or aching in more than one joint, stiffness in more than one joint, tenderness and swelling in more than one joint. Importantly, we have to focus that it is written more than one joint. So it is important for the RA to occur in more than one joints or two. So the same symptoms on both sides of the body may occur: weight loss, fever, fatigue, and weakness. These are the other symptoms associated with that. Understanding the causes, the following can play a part why someone has RA. So age is the major factor. It is basically the middle-aged disease. If it is middle age, it is known as early onset RA, and it is common in women than men. Weight: if a person is overweight, then it has significantly greater chance of developing RA than if you are a healthy weight. So determining the overweight and healthy weight is by BMI calculation. According to your height and weight, it calculates your BMI, and if it is 25 some, then it is a healthy BMI, healthy weight. Now, another major factor which increases the chances of RA is the smoking. It increases the individual chances of getting affected with RA. Diet. There is some evidence that if you eat a lot of red meat and don't consume much vitamin C, you may have increased risk of developing RA. Now we get into the diagnosis. So first of all, there is a blood test in which we perform the ESR, CRP, NTCCP, and RF, rheumatoid factor. So ESR is the level when the RBC sink faster, the level of inflammation is high. Understanding the lab report, this is the dummy lab report. As you can see, the NTCCP, which is positive if it is greater or equal than 17, but here it is less, so it is negative. So yes, RF and NTCCP antibodies are very important in the diagnosis of the rheumatoid arthritis, where CCP is the citrullinated protein antibodies in the body. Now another that can diagnose is the scanning of the joints. If we do the X-ray, ultrasound scans, and MRI, magnetic resonance imaging of the joints, we can find out if there is any kind of inflammation, or we can determine the swelling as well, which will confirm the test of rheumatoid arthritis. Now the most important in this video is the treatment of the RA, which is the which has three basic parts, which is the drugs, physical therapies, and surgery. Understanding the drugs part, we have four groups: painkiller, NSAIDs, DMARDs, and steroids. DMARDs is a disease-modifying anti-rheumatic drugs which plays an important role in the treatment of RA. Painkillers like ibuprofen can help to relieve the pain caused by the rheumatoid arthritis, but it should not be used as a treatment only. Now, DMARDs, that is disease modifying anti-rheumatic drugs, has 3 types, that is conventional, biologic, and targeted synthetic DMARDs. Now, understanding the conventional, biologic, and targeted synthetic types, which we have nowadays: azathioprine, hydroxychloroquine, which is the conventional synthetic, methotrexate, sulfasalazine, infliximab, adalimumab, golimumab, tofacitinib. So these are all the categories of the DMARDs, in which we have the biologic, conventional, and the targeted synthetic types. All the MABs you can see is the biologic type of DMARDs available. Now, understanding the steroids are sometimes known by their full name, corticosteroids, which helps to reduce pain, stiffness, and inflammation. NSAIDs also does the same. We have available tablet, capsule, liquid, and suppository. Thank you.